patient has come with swelling in the thyroid in his neck for the past 3 months. Examine his neck and discuss the diagnosis with the examiner. Okay. Most probably in thyroid, there won't be any diagnosis, no swelling, nothing. Only the tremors will be there. If the examiner asks about the positive findings, just tell about the findings. Like I could appreciate only the tremors. I couldn't appreciate this thing, everything. Whichever negative findings for thyrotoxicosis. Examine the thyroid gland and look for signs of thyrotoxicosis. So this is my GMC number. Shall I proceed with the task? Hello, Mr. Vishal. I'm Dr. Mohan, one of the doctors in this department. I'm here to examine your neck. For the purpose of examination, you need to undress above the waist or above the mid-arms and ensure adequate privacy. Ask my examiner, kindly be the chaperone. Is that okay? During the examination, I'll be verbalizing my findings to the examiner, so kindly hear with me. My patient is normally dressed. His weight seems to be normal. Could you please raise your hands like this and stretch your fingers? I could appreciate fine tremors. I couldn't appreciate any clubbing. I couldn't appreciate any pallor or any koilonychia. Could you please turn your hands? Thank you. I couldn't appreciate any abnormal sweating or any palmar erythema. Ideally, I'll be looking for the pulse rate for 1 minute. The pulse rate is normal in my patient. 15 seconds. The pulse rate in my patient is 68 beats per minute. Ideally, I should have measured the blood pressure as well. I couldn't appreciate any alopecia. Could you please look up? Could you please look down? I couldn't appreciate any pallor or any icterus. There is no periorbital swelling. Could you please protrude your tongue for me and hold it a bit? Thank you. Could you please roll it back? And could you please stick out your tongue? Roll it back. Thank you. I couldn't appreciate any cyanosis. I couldn't appreciate any swelling on protrusion of the tongue. I couldn't appreciate any fibrillation of the tongue. Can I have a glass of water? Sure. Assume. Could you please take a sip and hold it in your mouth, and whenever I say yes, just swallow it. Okay? Could you please swallow it now? I couldn't appreciate any swelling that moves on deglutition. I couldn't appreciate any puckering of the skin or pre-tibial myxedema in my patient. On inspection, I couldn't appreciate any discharge, any redness, any scars, any sinus, any swelling in the anterior aspect of the neck. The trachea seems to be central in position. Mr. Vishal, now I will be touching you for the purpose of examination. If there is any discomfort at any point, tell me I'll stop my examination. Is that okay? Can I have a glass of water? Could you please again take a sip and then hold it in your mouth, and whenever I say yes, could you please swallow it? Could you please swallow it? I couldn't appreciate any swelling that moves on deglutition. I couldn't appreciate any localized rise in temperature. I will be touching a bit. I couldn't appreciate any swelling in the anterior aspect of the thyroid gland. The trachea seems to be, I'm really sorry, are you okay? The trachea seems to be central in position. I could appreciate the carotid pulsation in the normal anatomical position. Now I will be going behind you, Mr. Vishal. Is that okay? Could you please look backwards and look towards the ceiling? I couldn't appreciate any proptosis, any exophthalmos. Now I will be touching you. Okay. I couldn't appreciate any swelling in the anterior aspect of the neck. Could you please bend forwards? Thank you. I couldn't appreciate any submental, submandibular, any preauricular, post-auricular or occipital group of lymph nodes. Could you please turn towards your left side? Thank you. That's it. I couldn't appreciate any anterior or posterior group of cervical lymph nodes on the right side. I couldn't appreciate any anterior or posterior group of lymph nodes on the left side. Mr. Vishal, now I will be gently tapping you. Oh, sorry. Ideally, I should have looked for the supraclavicular and infraclavicular group of lymph nodes. Could you please, now I will be gently tapping you. Is that okay? I couldn't appreciate any dullness on percussion, on sternal percussion. Now I will be listening to your neck. Is that okay? Can I have a stethoscope? the stethoscope. Will you please hold your breath for a few seconds? I couldn't appreciate any thyroid breathing. Now we can breathe in. Thank you, Mr. Vishal. You've been very cooperative. Now you can result. Ideally, I will complete my examination by looking for the sleeping pulse rate, examining the cardiovascular system and also the reflexes. Thank you. Eye signs. You should look for the eye signs. In the front. Eye signs. Could you please follow the tip of my finger without moving your eyes? Okay? Without moving your head. Sorry. Lid lag. This is lid lag. And gaze test. Gaze test, you know about it in clinical examination class in diploma station. Okay? More about it. Now, it will be a negative finding in thyroid. Could you please follow the tip of my finger without moving your head? Whenever you see double vision, just let me know. You see any double vision? My patient doesn't have any lid lag or ophthalmoplegia. Thank you, Mr. Shah.
ये किस जगह पे आएगा?
Anybody?